Unfortunately, I got divorced, I got depressed, and I didn't want to stay in Phoenix anymore, so I flipped a coin and then landed in San Diego.
When Frank Serbay moved to San Diego in 2022, he had nowhere to stay.
I came off that Greyhound bus and saw all that tents. I'm like, what did I get myself into? I was thinking about, okay, I got $100 left in my pocket. I'm going to go back to Phoenix. But I gave it a chance.
Serbay, now 59, says he was struggling with alcoholism.
So I lost my job, my house, my car, my dog. I lost everything.
Serbay found shelter at Father Joe's Villages in downtown San Diego. It was at their health center he had a pain in his leg checked for the first time and discovered he had a tumor.
I had major surgery done on my leg, which they took a tumor out the size of a golf ball.
After surgery, he needed additional care. Melody Thomas directs patient care and case management at Scripps Mercy Hospital. She works to find unhoused patients recuperative care. She says without a place to heal properly, those requiring ongoing attention may find themselves back in the ER within days.
If you need to recuperate from the hospital and you are homeless or unsheltered, that is an option. Recuperative care is usually a higher medical need than what they could manage at a shelter bed.
Homeless individuals often seek emergency care for immediate needs, but are released when they are medically cleared, even if they require ongoing care. Thomas says last year, Scripps' 5 San Diego hospitals treated 22,227 homeless patients. This year, they're on track to double that number. State law requires hospitals to track and create discharge plans for homeless patients, connecting them to shelter options. Thomas says the challenge is the shortage of beds and difficulty accessing recuperative care programs.
That process does vary based on managed Medi-Cal. So how and when we can get authorization for that, specific bed, then determining the timeliness of getting the patient into the recuperative care bed is where you may have heard. That's, I think, where the opportunity is.
Some patients who need recuperative care may end up back on the street because there can be a lag between when a patient is released from the hospital and insurance approves it. Thomas says it's challenging to know how many people need recuperative care but don't get it. Some patients give up during the waiting process. Others need it but refuse it. After his surgery, Serbay recovered in the recuperative care program at Father Joe's Villages. The program has 28 beds, and patients are supported by on-site nurses. Jesse Casement connects clients to social services at Father Joe's Villages.
It's very different to heal in a tent or in a canyon or in the backseat of a car. And so we're able to offer a space like this that not only helps them with their physical healing, but with their mental health and just the relief from knowing that they're safe and can heal the way that they need to.
Serbay recuperated in a clean and safe room shared with just one other person.
So I got a peace of mind every night since I've been here. I watch my TV on my tablet, and it's just very peaceful.
Serbay can walk now and uses a cane only for stability after completing the 90-day program.
We have a very short time that we can work with them in recuperative care, and our case managers work very hard to help people exit to their next safe destination.
They also help with their finances and housing goals. Serbay's waiting to hear whether he's been granted housing in a converted hotel room.
It's just a room, but it's me by myself, and I don't need nothing more than that.
Heidi De Marco, KPBS News.